we don't have a drug that fixes the underlying epilepsy. There's some tantalizing evidence that the diet may be different, and the diet may actually have benefits beyond even when you stop it, again, suggesting you've altered the course of their epilepsy.
Hi there, I'm Claire McDonald-Lehoux and this is the Family Health Lab. In today's conversation, I'm talking with Dr. Eric Kossoff, Medical Director for the Johns Hopkins Ketogenic Diet Center, researcher and author. Professor Kossoff is the leading international expert on ketogenic diet as a treatment for epilepsy. We talk about ketogenic diet as a first therapy, his patients' incredible health stories, and why he is so passionate about this brain health diet.
You're listening to the Family Health Lab. Healthy parents, healthy kids.
Thank you so much for joining me from Maryland, Baltimore.
Absolutely. No, it's my pleasure to be here, Claire. Thanks for inviting me.
We've met at the Matthew's Friends Keto Clinic, and I saw that you were over there again recently. Your photos looked awesome, and it looked like part of it looked like a bike tour.
That's always what I do. It's my passion. I guess it was about 2-3 weeks ago. I returned to Keto College Advance, as they're now calling it, which is a pretty amazing training of a sort for dietitians who do the ketogenic diet already. It's advanced, so they're learning even more. It was very professional, very high end, lots of science discussed, probably about 100 dietitians, mostly from England. It's always a lot of fun to go. I learn just as much as I think I teach.
100 it's really phenomenal. They run that, I believe, every year.
Yeah. I think Julie does, who runs Matthew's Friends. I think she does a Keto College and a Keto College Advance. I think she will sort of alternate and do both a bit. Keto College being a little more of a basic training. It's a lot of work. Definitely a lot of work for her.
That's wonderful, and it's so wonderful that your daughter is following it in your footsteps. And was that a surprise to you? She's been a bit of a science. She's had a love of science for quite a number of years, I believe. But did you always know she was going to follow into medicine?
Yeah, no, she kind of made that decision sort of like in her teenage years, and then went to university, and I think that cemented it, her love for biology and chemistry. And yeah, I think she, liked what I did. She doesn't want to be a neurologist, she tells me, but it's early in her medical school. We'll see if she changes her mind. But yeah, it's wonderful for me to see. She's, very excited about it, and makes me proud.
Be a really, really proud feeling. You as one of the early pioneers of this diet that I find fascinating, but also really exciting with what's happening with it and what it's achieved for families. But I just wondered, back to the origin, what got you interested in helping people and supporting people with ketogenic diet therapy?
So, Claire, it's so interesting. When I did my training, medical school, pediatrics, I never heard of it. Absolutely never heard of it. And that was sort of the early 1990s. And most of our stories, most of us in the ketogenic diet field, who were in our trainings around then, have the same story. It was not discussed, or if it was like, a paragraph in a book. When I did my neurology training at Johns Hopkins, it was sort of a hotbed for ketogenic diet research and clinical care. It was one of the few places in the United States offering the ketogenic diet. My mentors, John Freeman and Dr. Patty Vining, were doing the diet along with dietitians Millie Kelly and nurse Diana Pillis. It was a very busy time in the ketogenic diet at Johns Hopkins when I was in my training. And so as a child neurology resident, a trainee, I was able to spend time with them and just really developed a love for it. I just found it so interesting, so unique. And I had, again, never heard of it. I was fortunate enough to be able to do an extra year of epilepsy training under Dr. Freeman and Dr. Vining. And during that year, besides learning about epilepsy, I really learned a lot about the ketogenic diet. And that was sort of in like the late 90s, early 2000s. that was really an incredible time for the ketogenic diet. Things were starting to skyrocket. Papers were getting published. The first two, randomized trials came out shortly afterwards. There was a lot of excitement in the field, and people were starting to coalesce as doctors and dietitians into a community of ketogenic diet experts. And I had sort of just started my career, and I decided to stay at Johns Hopkins and stay in Baltimore. We thought, my wife and I, we were going to move back to New York or somewhere else, but I said, "Oh, give it a try. I'll stay here for maybe a couple years." And 20 years later, I'm still here.
Yeah.
It's an engrossing, very unique thing to do in medicine.
Mm.
It's a lot of work, but a lot of enjoyment and a lot of
Mm.
fulfillment. The changes we can do for people's lives are pretty amazing.
That's it for me. The changes, it's so different to any other type of therapy or approach. And I did read, or maybe I listened to a podcast actually with you sharing a story about when you were doing that initial training and you were being introduced to the ketogenic diet, you saw how it influenced one particular child whose seizures were controlled phenomenally well, who had failed medicines, medications had failed to stop the seizures, but the ketogenic diet had, and that touched you and gave you that impetus to want to work with this.
Yeah, that was a probably the first patient I saw. Dr. Freeman brought me to see, and he was being admitted, and we still do at Johns Hopkins mostly admit children for the diet. It's changed a lot over 20 years. It's a shorter admission, and we do it differently. But back then, it was usually about a week that children were in the hospital, often from far away, and this child was from pretty far away, coming to Baltimore to do the diet because it wasn't offered in his state. And so I met him at the beginning of his week, and then by the end of the week, it was pretty dramatic how quickly his seizures improved and how much better he was. That doesn't always, of course, happen, but this child was, a super responder and just, blew my mind. I was like, this is something I need to do more of. I
Yeah,
couldn't
what a
believe it.
feeling that you can have that kind of just change that outcome of that young person's life for forever. Yeah, which again isn't as possible with other treatments and therapies. When my daughter went on the keto diet, I think she was in ketosis within about 3-4 days, and then we noticed really quick changes with her seizure patterns and control, and over months they were less and less and less and less, and yeah, from hundreds a week to maybe 2 a year. So for us, it was a phenomenal difference. But we didn't get that super quick response of no seizures like that young person. But what we did get was better sleep immediately, better, calmer. The myoclonic seizures did go that week and never came back, so that they've been gone 10 years. So yes, so that's why I suppose seeing that in action, we just as a family became just such believers in what diet can do for you. And interesting how people are finding about the diet. I read something that you put out there that says that for all the work, I mean, you're so lovely to spend this time with me on this podcast, and you share so much information and put so many presentations out there. You lecture, put so much information out there, and those papers, those research papers. But parents are still coming to this. Often they're finding this diet through their own research online. Is that still the case, do you think?
It's definitely changed. We actually did like a survey of families a few years back where we asked them where they found out about the diet. And this was a US based survey of, for the most part, our patients. So a little bit of a select population. But what was, I think, not too surprising was how much it was from the internet. Doctors maybe mentioned it, or another parent mentioned it at a meeting, and they got on the internet. I mean, there's books,
Mm.
there's papers, there's articles. I mean, the famous story of Charlie, from the Charlie Foundation, whose dad found out about it in the UCLA library. Nowadays with the internet, it's quite easy for families to get good information from the Charlie Foundation and Matthew's Friends, epilepsy.com. Lots of great websites that have very good, reliable, usually, neurologist or dietitian written resources. Wikipedia is actually pretty good too. So, there are books. We wrote a book, our Ketogenic Diet Center, and parents do read it, but I think most of them are finding out about it mostly from the internet. Like the doctors are mentioning it and saying, maybe some good, some bad things, and then the parents can find out on their own what it's about.
It's a huge change. Even 10 years ago, our daughter's now 12. She's been on the diet for 10 years. And when we first found out about it, we were in many, many meetings with our neurology team. And we were reading a lot of information, looking at as much as we could around. But it was a parent's blog, actually, that they were in Canada, and their little girl was taking a packed lunch to school, and she was drinking a little pot of olive oil with everything she ate for her epilepsy, and that was controlling her seizures. So I was then thinking, wow, what's this magic pot of olive oil? And that's got us started. And the resources that we read initially were all from John Hopkins Center, from your work, your papers, your research. So your name cropped up really early on our hunt for more information. And I told Emma Williams from Matthew's Friends that we were doing all this digging. We were contacting people. I think I contacted Matthew's friends initially. There wasn't as much open information about what a ketogenic diet was, how it works, how to do it, and the recipes. That wasn't as free even 10 years ago. But yeah, I was doing all this research, then took this to my neurology team and asked about the ketogenic diet, and they were like, "Oh, there is one at the hospital. There's one here," and they hadn't mentioned it to us because we weren't at that point we weren't classed as an intractable epilepsy, which is a type of epilepsy that intractable meaning that you have tried multiple medications first and they've failed to control your seizures. I believe that's the term. So they hadn't mentioned it to us because it wasn't on our pathway. So that's got us started. But you mentioned that some neurologists and some teams and some professionals may be telling parents about the good, but they might be telling them about the bad. So that leads me to ask about, it was controversial. It's much more accepted in the 20 years you've been working and producing this raft of evidence about how effective it can be as a therapy. There was a lot of pushback from professionals before, and now things have changed. But a parent going into an office, say this week, and talking about their child with epilepsy and the treatments available, will they be told about ketogenic therapy? And if so, what are they likely to be told? Is it a mixed bag still?
It's a super question, Claire, and a lot of it depends sort of where in the world you are. There's, some areas of the world that we still have work to do. They don't have the ketogenic diet in certain countries. It's changing rapidly, but if they don't have it, obviously they're not going to offer it if they're resource limited or just don't have a center. There are places like the United States and England where it's widely available, but maybe some centers don't do it as much as other aspects of epilepsy care. When we treat epilepsy, there's medications, there's epilepsy surgery, there's neurostimulation, and there's diet therapy. So there's sort of four major ways we treat epilepsy. And so some centers really focus on epilepsy surgery. And so they're, sort of leaning towards that. Some centers really do much more medication management or have new drug trials. So it can be, somewhat center dependent. I think it's definitely changed, especially, well, at least I can speak to the United States. I think you're right. Okay, it is absolutely an accepted mainstream therapy. I think we're mostly past the time when doctors would say there's no evidence, it's voodoo, it's, unorthodox, it's, a sort of alternative therapy. We don't use that word anymore. It is very well established. It's just a non-pharmacologic therapy. It's different than drugs. So I think at least in the United States, I would say most child neurologists, and it's starting to gain some acceptance for adults, which is really a fun topic too. But for at least pediatrics, I think you'd be hard pressed to find a child neurologist who, when you would ask them, if you would ask them, do you think the ketogenic diet works? Is it a viable option? Most of them would say absolutely. I think how often they promote it, how often they bring it up in their treatment algorithm can be very different. So obviously I do a lot of it. I will sometimes bring it up more early, and if we have time, we can talk about their situations. We'll use it first, which is a very hot topic now in our community, using it before medications. There are situations where it actually makes sense. So I may say after maybe 2 drugs, you may want to start reading about it, get some information. We can talk more about it later, try some recipes. So I'll start to bring it up as an option. But there are other centers where maybe now there's so many, even more drugs than 20 years ago. So they'll try, drug after drug sometimes. And it does sometimes depend on the parents, and I hear that story a lot. A lot of families that come to me, are from other hospitals, from other neurologists, and they will say that, the neurologist said, great, you can try it, maybe go to Johns Hopkins. So they're supportive, but maybe they didn't bring it up until the parent mentioned it. So it's something that, we're trying to get the word out, through, again, Matthew's Friends and Charlie Foundation and talking to other neurologists. When I lecture, I, bring up how valuable it can be, and they should think about it sooner than they're maybe doing.
And sooner, you mentioned that was a hot topic that I find it's a particular interest of mine, the options being there, being open, and parents then having the opportunity to get all the information, decide whether it's right for them, for their child to try or not. But at the moment, the vast majority of epilepsy cases, the ketogenic diet wouldn't be offered as a first line therapy, I believe, and unless it's a particular type of epilepsy that's been diagnosed. But generalized epilepsy would generally be medication first. Is that still the case?
Well, yeah, I mean, there's so many types of epilepsy. Epilepsy is a very diverse condition. But what's become clear over the past 20 years through our research and lots of other centers is that there are situations, indications, so to speak, where the diet may be better in some cases than some of the medications that are available. The diet in general works for about 55% of children, and about 15% will become seizure free. And this is data from the most sometimes intractable, refractory to medicine cases. There are some epilepsies where the diet is 95% effective. Okay, that's one of them is called GLUT1 deficiency. It is the best treatment by far that we have today for that condition. The diet should be done first, not after medicine, although sometimes medicines are tried before the diagnosis is made. That's, that does of course happen. A lot of diagnoses are now genetic. Sometimes, again, it can be, time and realizing that it's becoming intractable before the diagnosis is made. But some of these conditions include a condition called Doza syndrome or epilepsy with myoclonic atonic seizures. The diet, way better than any medication available. And people have talked about doing a trial where maybe you failed one drug, you're randomized to either diet or a drug and see which one works better. We know that pyruvate dehydrogenase deficiency, it's a metabolic condition. The diet is absolutely the best therapy for that. Infantile spasms, one of my personal interests, that affects babies, and they come into the ER, usually new onset. We know the diet's very effective. We have offered it first, and we tell the families, let's try it. If it's not working in maybe 2 weeks, we'll give it a very limited time frame. We will then go to a different option, usually a medication. We have a trial now at Johns Hopkins looking at it for absence epilepsy, one of the most common and usually very treatable epilepsies with medications. But we've had families try the diet. We've had families say it worked. And so we have actually a trial using a version of the ketogenic diet called a modified Atkins diet for new onset absence epilepsy, not only to see does it work as a first line therapy, because you would think it would. If it works when seizures are really, really tough to control, why wouldn't it work when they're just starting? But the other part of these new onset studies as they're going on is to see, is it feasible? will parents do it? When given a choice, will parents choose a diet over drugs? It's not so simple. It is a lot of work at times going on the diet. So these are like fun questions that our community is asking, and probably again the future of the diet is to use it sooner.
I like that you term it fun because it's a heavy topic, really. Neurology, epilepsy, seizure control, and a ketogenic diet therapy. But you do seem to enjoy and exude a lot of enthusiasm and joy around this topic. So possibly, I mean, it seems to be your personality, but also possibly doing this type of work where you're helping so many people and seeing a difference and make a difference in so many people and families' lives. It must be, yeah, quite joyful, really.
I've seen a lot over the years, Claire. I mean, I've certainly seen cases where the diet didn't work well, and it's disappointing for me and my entire team. It's not that the family didn't do it right. It's just it's not always the right choice for some children. But then we've seen some absolute miracle type cases that you take home with you, and they're wonderful. I've been doing this, as you mentioned, now for about 20 years. So some of the earliest cases I took care of when I was just out of my training, they're now going to college, or sending me letters or writing books. It's pretty amazing about their experiences. And so it is wonderful. I often call it a labor of love. I think if you talk to most ketogenic dietitians, I know you spoke to Beth Zupek-Kania. It's a fair bit of work. It's a lot easier for neurologists. Well, it's relatively easier to pick a medicine, prescribe it, and do that. We get probably the most messages and contacts from our ketogenic families. But I think it's worth it. I enjoy it. I think my team does too.
You were interviewed, yeah, by a former patient of yours in the UK, I think, Emily. So a young girl who has her life had been transformed by your research and your work and this diet. It might not have been in the UK actually; it might have been in America. I'm not sure, but I just wondered how that felt. If you remembered that interview of a young lady.
Yeah, I remember that, and again, I interact with so many former patients now. One of my former families, I saw them in an airport. They follow me on Facebook, and they knew I was in their city, and they said, "Oh, we'll come to the airport and meet you," and that was
Oh,
amazing.
that's wonderful.
Um, one of my favorite cases, one of my favorite patients is a girl named Carson, and I use her name because they created a foundation, the Carson Harris Foundation. It's on the internet, and she had infantile spasms. I took care of her back in 2007 when she was 6 months old, and we put her on the ketogenic diet as a first-line therapy before steroids or vigabatrin, and she had a remarkable response. And after 6 months, we took her off the diet, and she's now about to be a senior in high school. She's interested in going to medical school. They live in obviously my area, so I see them pretty regularly, and they've created a foundation, and they're very supportive of our keto center. Incredible,
Mm,
to see that, span that was 18 years
mm.
of her development, and
And it's
it's great.
finding the right therapy. It is changing somebody's outcomes completely. Um, our daughter is thriving. She's doing well. She's in choir at the moment. She sails. She's doing water polo. She's active. She's in mainstream school. She's just who she should be. And I believe it was finding the ketogenic diet therapy, the right therapy for her at the right time. So it's fascinating to me that you're using this approach so young with those babies. So I'd love to talk to you about that. But just on the
Right.
first line therapy, as the medical terminology says, as a parent, I wanted to have had a look at all of the different options. CBD was an emerging option that we were looking at. There was the medications that we were looking at. There was surgery, as you've said, um, and then the ketogenic diet seemed to us to be a bit of a no-brainer. It seemed like olives, avocados, fatty meats, fish, eggs, that those types of food could change the way the brain works and the way the brain is fueled, and seemed out of everything seemed to have the least potential side effects. Although there are side effects, they could be mitigated, particularly if we started on a low ratio, modified Atkins, as they call that, low fat ratio. So it seemed like a no-brainer. We wanted that first as our first option therapy. But it wasn't going to be offered. So in fact, we personally, and I'm not saying that this is what parents should do, but we went and did that ourselves privately, and then we went back to the hospital, and the kind dietitian there saw us in the waiting room. Her books were full and she couldn't see us, but she unofficially met with us and just gave us those blood tests and gave us the support. But my concern is that parents who want this as a first therapy, they might not necessarily be able to have that choice. Is that right? That they can't get the support now unless they fail medications first?
Well, so it's an interesting dilemma and question. Again, still it can be country specific. There are some areas of the world where dietitians are limited in terms of the number of patients they can see. And so the dietitians may say, no, I can only see patients that have failed several medications. That's what I am contracted to do and what I can do. And they may, again, have a cap or a limit on how many they can do. In the US, that occurs, but maybe not as much. And we maybe have a little more flexibility. The neurologist could suggest the ketogenic diet maybe after one drug has been tried, or maybe theoretically first line if they're interested in that. As long, the dietitian has to help and be willing to. But for the most part, it can be done. The barrier sometimes is the insurance companies in the US paying for the admission. So if you want to admit a child to the hospital in the United States, the neurologist has to justify why because it is an elective admission. It's unless they come in like as an emergency. So the insurance companies have in their books that the ketogenic diet is approved, so to speak, for children who have failed at least 2 medications. So I have had on occasion children that I've tried to admit who failed 1 drug, and the insurance company said, we're not paying for the admission. Now, what could I do, right? You can do it without an admission. A lot of centers are doing the ketogenic diet as an outpatient. A lot of centers would say, well, maybe let's try the modified Atkins diet because we don't have to admit for that. Some centers might say, all right, well, maybe we'll try one more drug and we'll try again, if that doesn't work. So it can be a barrier. Those sort of rules and sort of regulations sometimes do limit it to children who failed multiple medications. But as you mentioned for yourself, I think the world is changing. Families, and I don't advocate for it, but some families are trying the diet on their own, even without a dietitian. Some of them are hiring, for pay, private dietitians who will be contracted to help them and help their neurologist. That's a growing trend that we're seeing. But again, some families are stumbling upon it, and say, hey, let's give it a try. And, in some ways that when I created the modified Atkins diet, the first patient was a mother who did that. She was ready to do the ketogenic diet. She had about 3 days to get ready for it. And Dr. Freeman told her, well, it's high fat, low carb. And she wanted to know what that meant. And he said, oh, it's like the Atkins diet. You can read about it this weekend if you want to. And this is a famous story. And the child who's now she's 27 years old, on her own, the mom did basically a modified Atkins diet. The child was in ketosis and her seizures were dramatically better. And so we actually canceled the admission that was planned, that insurance had approved. We actually canceled it and said, let's just keep doing what you're doing.
Mm-hmm.
So, that is happening. Again, I don't advocate for families doing it without support. As you mentioned, there are potential side effects to the diet. Children can lose weight. They can have high cholesterol. They can have reflux, constipation. So, we do need to check labs. We need to have a dietitian check on their height and weight. Vitamin deficiencies are absolutely real. So you have to make sure, children are getting the supplements that they need. So, it's not something we suggest, but we have had families in a similar situation to you, Claire, where, they've said, can we have an appointment because we've started it, it's working, we just need help.
Yeah.
And we try to squeeze them in if we can, but we're all busy, of course.
That's a big difference between a neurology unit that's mainly dealing with pharmaceuticals. This does take more capacity in terms of those blood labs, in terms of dietitians looking regularly at the nutritional diary that you're putting together and checking. I think it's a 3-month clinic check that you do, and some clinics it's a 6-month check, depending on the child and the case, I guess.
Exactly. Yeah, usually we see children on average about every 3 to 6 months, sooner the early parts of the diet, and the longer they're on it, we may space it out a
Mm.
bit more. But yeah, no, it's an important thing that we keep in close touch and make sure they're safe while they're on this diet.
So initially, in the beginning, maybe 20 years ago, it was predominantly children who were receiving this therapy.
Exactly.
And now it's mushroomed, blossomed is probably a better word. You're dealing with different types of syndromes, but also adults and babies. So that must make it really interesting for you to see those different cases.
Yeah, so on both ends, it's definitely burgeoning, absolutely for sure. So adults has sort of exploded using diet therapy for adults over the last 10 to 15 years. My partner at Johns Hopkins, Dr. Mackenzie Cervenka, who'd probably be a great person for you to chat with, created our adult epilepsy diet center, and it was one of the first in the world. And now I think there's 20 or 30 around the world. And she will point out when she lectures that if you go back to the 1920s and 1930s, some of the original reports on the ketogenic diet were adults, and a lot of adults have epilepsies that started in childhood and don't go away. So, why wouldn't the diet be helpful for adults? Lots of interests. There's special dietitians that will see adults, and they have obviously different issues than children do. And the outcomes can be quite good. Compliance can be an issue, of course, for a busy adult working. Less of an issue, perhaps, still can be for children. The parents can kind of make them do the diet, not so much for adults, but it's an exploding sort of population that are going on diet therapies. And then, as you mentioned, on the opposite end, the extreme end, we're seeing infants. There's actually reports of young babies, even as young as like a few hours old, starting a ketogenic diet. That is an incredible sort of change. For many years, it was thought that babies cannot make ketones, that babies, it was too risky to put them on a ketogenic diet. There's actually now data suggesting maybe even the opposite, that babies are more likely to respond than some of the older children. And it may be due to their syndromes. Some of the epilepsy syndromes that affect babies seem very ketogenic diet
Mm.
responsive. But it may be just a great population. There are formulas available, multiple ketogenic formulas that can be the sole source of nutrition for the baby. You just change their formula. It's not as simple as that, of course, but it is simpler than being on the regular foods that go on the ketogenic diet.
Absolutely, and that development of those different formulas that's really taken off over the last few years as well, with different choices now for parents. So there's more natural options as well, I believe, for
Mhm.
those baby formulas, which is really really wonderful. Um, and you mentioned back to the 1920s, and it's often, I think, when people hear the ketogenic diet, some people come to this as it's got a reputation as a fad diet or a weight loss diet, and it's been on trend for the last few years, and I think it's now plateauing or actually
Mhm.
trending down. But this diet has been a therapy in the research and in cases of epilepsy, as you say, since the 1920s, and we've got references dating back. Fasting was used in historical contexts as well for seizures and different ailments. So the history is fascinating, I think.
Yeah, no, you're correct. So, I mean, it probably goes back to biblical times where they talked about fasting and starvation helping this condition, which they didn't fully understand. In the late 1800s, there were water diets and periods of starvation being done. A lot of research in France about that. And then it was 1921 when the first ketogenic diet, as it is still in many regards very similar today, was created at the Mayo Clinic in Rochester, Minnesota. And so that was the classic ketogenic diet. And in the 1920s, 1930s, there were very few other options for children and adults. So lots of papers, many sort of research studies being done at major institutions. It was quite popular. And then sort of in the 1950s, 1960s, it decreased for many reasons. We had new drugs coming on the market. A lot of the research that was being done, those researchers, passed away or moved on to other fields. There wasn't a lot of junior faculty doing the research. And then that started to change again in the 1980s, and then absolutely in the 1990s with the Charlie Foundation helping support research. Matthew's Friends, things really started to take off. And younger people started to be involved in our field, started to do research, be more collaborative. So there were studies being done at many hospitals, not just being done at one hospital. And then we started having meetings. And then so in 2008, we had our first ketogenic diet sort of international conference. And we've now had 8, I think, maybe 7, about to have our 8th. I have to check on that. But we just had one just recently in San Diego last year. And the next one's going to be in Paris in 2025. And we get about 500 people together and just talk about research in the ketogenic diet. And just recently, a few years ago, we actually formed a society, as I think we had enough of an impetus to get that together. It's called INCS, or the International Neurological Ketogenic Society. Beth Zupek's on the executive board, as am I, and it's really exciting. And to not only run the meetings, but sort of we have a website, and we're just trying to raise awareness, but also really help grow the science for the next 100 years.
Is that mainly for epilepsy, or is it for brain injury? Is it for different disciplines as well?
That's changing too. I mean, again, the N in INCS is for neurological. So most of our work, most of our members are in neurological fields, neurologists or dietitians per se. And the vast majority are doing epilepsy work like myself, but there's a lot of research being done into headaches and migraines, autism, dementia and Alzheimer's disease. There's research. Traumatic brain injury is being looked at as well. And then sort of one of the hottest topics right now is actually psychiatry, using metabolic therapies, as they're calling it, for bipolar disorder, schizophrenia, and other psychiatric conditions. And that's sort of also in its early stages, but preliminarily very exciting.
I've been following that work. That I think everyone's really, really excited by that, and that builds very much on the platform that you and Beth and the Charlie Foundation and others have created, and that research that's given this new wave that foundation. I was talking to Professor Zoltan Sarnai. He's in Australia, and he's studying ketogenic diet for schizophrenia, and that's a fascinating trial. It's blinded, and they have one cohort going through a particular diet and another going through a ketogenic diet, and they're studying the results of that. Then we have studies on bipolar in the UK, and then depression in America. That all on ketogenic diet with different cohorts. So I think that collaboration that you mentioned between different universities, different researchers, is definitely going to help keep the ketogenic diet relevant, and hopefully building on this scientific basis, so that we can get evidence and get these therapies out where they're needed for people. So what are you looking forward to next in your specific field? Is there a particular project, or what are you hoping for in the next 5 to 10 years?
Yeah, so there's a lot of exciting work that we're doing. I mentioned some of it earlier. There's a lot of work being done on an international level as well that I'm very excited about. Dr. Natasha Scholler from England is starting a registry, and it's in its early stages. Through INCS, there will be a hopefully web-induced, or but a better word is probably like a sort of database-linked registry that you would enter patients in, or the patients perhaps could enter their own information, but it probably will be done by doctors and dietitians, and we will get large numbers of patients and maybe ask some of the bigger questions about incidence rates and prevalence, and how likely are some of these side effects when you're looking at thousands of patients. Could be very exciting. So that's coming soon, this registry. There's also a study being done, also interestingly, out of the UK called the Core KDT. And what Core KDT is looking at is sort of for epilepsy, the sort of quality of life and things beyond just seizure counts. So seizure intensity, seizure duration, quality of life, cognition, sleep, like you mentioned, looking at like other aspects of how the diet can be helpful beyond just seizure numbers. And so that's going to be, I think, a mostly England study, but that's being started now. And again, as you mentioned, a lot of work in infants being done all over the world.
Yeah, I'm fascinated for that study. I'll have to follow that piece of work. When I was looking at the options for treatment for our daughter, who was, around 1 at the time we were looking at this, seizure control was our main priority. But really close to that was the our want to protect her cognition, her mental faculties, and give her the best treatment that would support that. And it seemed to me, from reading the work that was coming out of centres like yours, was that ketogenic diet had key advantages over medication in how I saw it. It seemed as though the lots of the pharmaceutical approach dampens down the brain areas that where the seizure activity is, and that might have an impact on cognition and memory, learning ability. Whereas the exciting thing about the alternative therapy, the ketogenic diet therapy, was that it seemed to have potential to protect cognitive function and in some cases perhaps even enhance. And we have been delighted with the outcome of the diet for us. It's very, very difficult in the first weeks and months, but that we were so new to it, and we were learning what carbohydrates were in what. I had no clue as to how much carbohydrate was in a milk or onions or garlic, and
Right.
I hadn't really wanted to know. But there I was, calculating, weighing, measuring until the early hours. Overcomplicated things, definitely, needlessly making these faffy recipes, and could have done it much more simple. But yeah, cognition. So I'm just wondered if you've got a comment on the benefits of ketogenic diet and wider benefits that you've seen in your time in your research.
Getting to cognition, that is a topic that is a bit controversial because it's so tricky to tease out, right? Because cognition improves when the seizures improve, right? And the diet improves seizures. The diet may improve the EEG, and we know having an abnormal EEG can affect cognition. And we also know the medications can affect cognition. Most of our children on the ketogenic diet, 80%, are still on medications too, but we may try to reduce the medications, usually after a month, if they're doing well. And if you can reduce or even stop a medication, that may also improve cognition. So most of the early studies that were done would report this, that yes, cognition can get better, but it was really hard to tease out what was responsible for that. There have been some more recent studies out of Europe where they've tried to account for all the different variables. Some have shown a benefit, some have shown, well, the benefit may be more for behavior, not necessarily cognition. So there's still a little bit of controversy out there, but I don't think anyone who does this on a regular basis would doubt that when children get better and their seizures get better, like your daughter, it's pretty dramatic sometimes how improvements can happen in school performance and learning. And it speaks to, I think, what you are getting at about the bigger question of what exactly, does the diet do, right? Where, most of our medicines, we have, a channel or a neurotransmitter that we know that the medicines affect. Sometimes they excite the brain. They can sort of raise a neurotransmitter that is excitatory or sort of modulate it. Some can actually, as you mentioned, sort of decrease a neurotransmitter that might be causing the seizures. Some work on channels, but there are a lot of medicines too, Claire, that we don't completely even understand what the medicine does or exactly how it suppresses seizures. The diet, for many years, we said we really just don't know how it works. Maybe ketones. That's why it's called the ketogenic diet. It has gotten much, much more complicated, with lots of sort of papers out there showing multiple mechanisms with boxes and arrows trying to show how the diet, may work. And it may have something to do with the fat. It may have something to do with keeping your glucose stable. It may have something to do with effects of ketones on mitochondria, sort of the energy producing parts of your cell. Lots of different theories. It's not just the ketones. There's some studies looking at the gut microbiome. Very interesting that maybe those changes that happen in the bacteria in your colon may be why your seizures get better, if those bacteria give you an inhibitory neurotransmitter, for example. But what's also interesting about all of these multiple mechanisms and studies is there's some hints that the diet may be what we call anti-epileptogenic. So all of our seizure drugs, for the most part, are anti-seizures or anti-convulsants. So they stop seizures. They make seizures less likely to happen. They don't change the underlying epilepsy. They don't make it go away any faster or alter the course of it. Obviously, we want less seizures, but we don't have a drug that fixes the underlying epilepsy. There's some tantalizing evidence in mostly animal studies, but some pediatric studies as well in humans, that the diet may be different, and the diet may actually have benefits beyond even when you stop it, again suggesting you've altered the course of their epilepsy. Hard to prove. You need years of follow-up to show that, but still, it's something that, again, I now been doing this 20 years. I've seen some children that you would have expected their epilepsy, even with drugs, to continue and cause lots of problems. And again, now some of them are going to college and doing amazing. And at least I believe that, the diet did something to alter the course of their lives that way.
It's the case with Charlie from the Charlie Foundation.
Exactly.
Yeah, Jim
Mm-hmm.
Abrahams was a famous Hollywood producer of movies that some people won't know, but some people, they were the famous movies. What were they called? Help me out, Eric.
Police Squad, Airplane.
Was one. And
Yep.
so he found the diet for his son in hours and hours and hours of research in a library, as you said earlier, which for me is fascinating now. It must be so hard for my children to ever imagine such a thing, that it's not automatically going to the internet and looking something up. So found this old treatment therapy that was no longer supported anywhere, and his son, who had tried so many different medical and pharmaceutical treatments, and nothing had helped work with the seizures. He tried the ketogenic diet, and that got his seizures under control, and then he no longer had seizures any longer. And then decades later, he's now in his late 20s or mid 20s.
I think he's in his mid 20s, maybe, but he's a teacher, and I think he boxes. He does all kinds of great things. Yeah, it's amazing.
I've met Nancy, his mother, but I've not met the rest of the family.
Yeah.
But fascinating, absolutely fascinating story. And then, of course, they produced a Hollywood movie about it with Meryl Streep in the role, called First Do No Harm. But yet that's one famous case, and I'm sure there's many others, but that's a fascinating area to look at, the epigenetic changes that this potentially creates, of this diet in the brain for some cases. So that's going to be exciting to develop the research in that area. And with all of the new research that's coming out of the different universities and different areas of the world, it's going to be fascinating to see how they tease out the different mechanisms. And it might be, some people are talking about energy uptake and different genetic reasons, like you said, excitability neurons and the gut microbiome, and there might be multiple factors in some different epilepsies, because, as you've said, there's so many different types of epilepsy and so many different causes of epilepsy. So I think the next 10 years, I'm really excited to see how this field of teasing out how the diet works and seeing it in more applications and earlier. I think that's where I'm hoping that it's going to all develop. You did touch on overseas and some countries and areas of the world not having access. Do you know of any projects, programs, or humanitarian work that's trying to help with outreach there?
There have been projects over the last 10 years through the ILAE, the International League Against Epilepsy. They actually created a task force on diet therapies with the goal of really trying to help developing countries with limited resources. I was the first chair of the task force. There's been now 2 more chairs, and so it's still very active. There's been a lot of work being done all over the world, and I think one thing I learned personally, is that, one size doesn't fit all. What works in America may not work at all in Africa or Southeast Asia. And so it does require boots on the ground, someone in that area who's interested, a neurologist, a dietitian, preferably both, that knows the region, knows the culture, knows religion, knows the foods, and can try to help get the diet available. And again, we now have multiple diets and we can do it as an outpatient. So it's gotten easier. But it still can be tough for certain regions. But there are still major areas of again, Africa, Central America, some parts of Eastern Europe where the diet's not available. But we're working to change that. But it takes time. It takes interest in those areas. It's not necessarily for us to bring it to them. They have to want it, and then we have to adapt it to try to make it more accessible. But that's also, again, a project of INC's that we'd like to do in the future, is help with trainings, help create materials for those regions in their language.
Spreading the word on ketogenic diet in terms of mentorship and supporting and collaborations is a personal passion of yours, because I've heard you talking about that as a way to evolve the diet, but also to keep it healthy and relevant, so that we don't have what happened in the earlier part of the century, where it became less and less resourced, less and less researched, and therefore we had less access to it. So yeah, I think that's going to be an absolutely phenomenal support. I think I got really interested in that because I was reading on a forum that parents, after a natural disaster in a country, weren't accessing their medications for their children with epilepsy. And I've been fascinated ever since about how we can support those who haven't been able to hear about this or access this and interpret it for their own needs and their own uses in their own countries. So yes, I'll do some reading, because I think that's really, really, really important, to be able to give people options and support if it's what they want, not to force this on anybody, but to give people the opportunities that we've been lucky to have.
It's nice of you to mention that. Mentorship is something that I'm very passionate about, getting the next generation of ketogenic dietitians and researchers and neurologists in the field, getting them involved, getting them to meet, the players that are doing this, to come to the meetings, and to become advocates. That's agreed. Probably a big part of what happened in the 1950s was there weren't sort of the next generation out there to kind of keep the diet going. So that's a big sort of personal project, and a project of INC's is to kind of work on mentorships and trainings, not just to start someone on the diet, but someone who's maybe has been doing the diet at their center for a few years, to help them go from good to great, to be a really bigger center and to join the community.
I think that's really important, because I think science and research generally has a lot of it has been done in silos, and it's been quite competitive. So to hear somebody at your level with your center to open that up and be so supportive of others coming through, knowing that is going to have a cascade effect to different centers around the world, and so touch so many families. Your work is going to just keep on and on and on. So that's I think that's really, really important. So thank you for putting that out there and doing that additional piece of, I think, really important work. To close, is there anything you would like families to know, or how would you suggest they initially start to do their own research, or if they're interested in this, what steps could they take?
Well, the first message, which, I think we hopefully made clear, is be an advocate, but, if you can, hopefully don't do it on your own. Get help. There's a lot of support out there. There's, again, great parent support groups, Matthew's Friends, Charlie Foundation, the Epilepsy Foundation, sometimes of regions and countries, that can be extremely helpful with materials, resources, even sort of cooking materials that, they can give to families to help them on their journey. But, it also is important to do research on your own, right? I tell families, it's okay. Go to the internet, look at recipes, read about it, ask questions, and if a neurologist says, I don't think it's appropriate, talk about why. They may have a good reason. If you disagree, it's okay to get another opinion, see another neurologist, and, see what they think. Reach out to other parents. There's just so many parents out there, who are doing things like you're doing, Claire, and helping with the parent support groups. Lots of things out there that are run by parents, books written by parents too, that can be helpful. Go in knowing what you're getting into. The last thing we want as a ketogenic diet team, is for a family to start the diet not understanding what it's going to be and how much the work can be, as you mentioned, the first month or so, or sometimes longer, and give up after a short period of time. That's obviously can be frustrating for us, and we just feel like, it wasn't given a fair chance. So we really do encourage families to do their research beforehand and make sure that it's the right decision for them and their family. And we've had children that we really thought it was going to be helpful for, and for various reasons, the family said it's just not the right thing for us to do right now. And we respect that. They may change their mind later, but sometimes they don't. Yeah.
I really do feel that the option and the support should be there if it is a choice that parents want to try. And I think tapering into the diet, so in the lead up to preparing, it's really helpful to start thinking about some of those foods that will have to go, not to you don't even have to go to restricting carbohydrates or low carb or getting close to ketosis, but there's plenty of work to be done initially to start kind of removing foods from the family home and switching out snacks and trying out recipes. So that initial pieces of work can be quite useful for families while they're gearing up towards trying the diet with support. I thank you for your time. This is, I think, really, really important to me, this conversation, this topic, getting this information, and so that parents in this situation can get themselves geared up, get themselves ready, understand it, make decisions, and get access to support. So the work that you've been doing over decades has really impacted my own family personally. And it has just impacted so many thousands of families around the world. So thank you so much, Dr. Kossoff. I really appreciate your time.
Oh, it's absolutely my pleasure. No, I'm glad to be here. Thanks for inviting me. This has been fun.
Thank you for watching. If you like this video, please make sure to subscribe. This really helps us to be able to create more content.